Dr. Dunaway here with Chiro Strength. In today's video, we're going to touch on the side plank because it's an amazing drill that can be modified a bunch of different ways depending on what your patient or client is having an issue with. This lateral chain stability is going to be so important for gait, so important for stabilizing the lumbar spine and the pelvis. And so if you have any issues with this, it's going to be really hard to recover from anywhere from a knee, hip, lumbar spine issue if we're not able to get this lateral chain nice and stable. So remember, with any core drill, it's a breathing drill first. So making sure we have a good breathing bracing strategy, which you can kind of find in some of the other videos I've posted regarding the dead bug breathing bracing strategies. But here's where we start with the side plank. What we're going to start with is on your knees. Knees are flexed to about 90 degrees because what I want to do is as you come up into a good side plank, meaning we're pushing away from the ground, our elbow's not directly underneath us getting crammed like this, but we're in a good, nice, tall chest position, locked in, our butt's going to come up and then forward to where we make a good straight line. Now in this straight line, we should be able to hold this for about 30 seconds before we move on to any variation, making sure my neck is nice and stable, I'm not up like this, and this will be the good foundation for this. If you start to feel yourself trembling or shaking, that's a good idea, a good indication that we need to stop, reset, and start accumulating reps as opposed to holding a rep through that trembling or shaking. So from here we can do a couple different things from the knees. One thing we can do is we can work on some clamshell variations here. And as we come up, we can lock in that hip and start working on peeling that away and making sure we're not getting any motion at the spine. It's a really great way to isolate the glutes. The downside glute and the top side glute both get more activation here as we're peeling those knees apart. If we want to try to band some internal rotation, a lot of times people will stretch passively and not make a lot of progress. But with this variation here, you can actually band internal rotation, which a lot of times will help unlock that motion, which is often a limited motion in the hips for most people, especially if you're sitting a lot. So we can get a yoga block, put between the knees, again, good side plank position, lock in, come up, and now what we're going to do is we're going to put that band now that we had around our knees a second ago, around our ankles, and just start peeling that apart and working on banded internal rotation. Again, I'm getting a good burn on my down glute because my knees are apart here, and this will be another good variation for the side plank just to kind of throw into the mix, especially if you have limited hip internal rotation on one side. So from there, we'll go on to our feet. Again, a simple progression with our feet stacked is a good progression using the same kind of side plank variations. But a lot of times, if you have a painful hip or something like that, and we're wanting to train the QL, but we have an overly tight glute med or something like that on this side, what we can do is we can take the top leg, let that top leg be the one we push off on, and take this back leg here and just kind of put it on top of that leg. So now as I go up, I'm actually using this adductor and this QL, and this downside hip actually has a lot of stress taken off of it. So if the painful hip is preventing you from getting to a side plank, we can still train a good lateral chain, especially the obliques and the QL here. We can still train a good side plank without needing to overstress that hip. Now another variation that I like moving towards, because I really like the rotating side plank, is this kind of scissored position. So now you have your top leg in front of your bottom leg, about heel to toe, maybe a couple inches apart, and all we're going to do is we're going to come up, and now this leg and this leg is sharing the stress, allowing us to set up for a good side plank rotation, whether we're going down and back up or all the way over. So regardless of what you're dealing with from a standpoint of a rehab protocol or a strengthening protocol or performance program, the side plank should be somewhere in there, and there's a lot of different variations. Train that lateral chain, and just make sure you do it in a comfortable position. Again, make sure breathing and bracing is always on the forefront of your mind when you're doing this. Train within your comfort zone. And if you have any questions, you can message me on the bottom of this video. You can always reach me at drdunaway@chirostrength.com. And like I always say, don't just mend, transcend. Thanks.